This podcast is supported by an educational grant from Kindred Bio. Hi, this is Dr. Susan Little.
And Dr. Yola Kerpenstein.
I got it right in there that time.
And you did.
I jumped in.
And it is the Cat Café Podcast.
This is the Cat Café Podcast. So it finally has a name. The first episode or first two episodes we didn't have a name.
No, we had a couple of episodes that we did not.
We had
have
no
a
name.
but...
And then we did a little social media contest. And
got a great name.
Yeah,
that's great.
Yeah, because we had sort of lots of all the names that we liked were already taken. And then we had a little social media contest, and we came up with Cat Café Podcast.
Yes.
Yola and I both love coffee, so
yes, and we love cats.
And we love cats.
Easy,
I love
easy.
cats too.
And then we have a great logo that we will show you.
We have a new logo.
We love it,
and it involves coffee.
And cats.
Surprisingly,
and cats.
And cats.
So we have two rules during this podcast. One is no D's, no D words.
D-O-G word.
Mm-hmm. And the other thing is no difficult words. So I will warn you when you do it, and then you have to explain what you're saying.
Okay.
You know, because as vets, right, we learn a certain language.
We do.
That we speak to each other, and we have to change that when we speak to people who they're not scientists or they're not veterinarians, right? We have to, which is challenging.
And we're going to talk about anorexia. So what does that mean?
Oh, there's a good word.
Oh, I know. So I was going to say that. I think that's a ding ding.
Yeah, it is.
I think we should introduce our guest first.
Yes.
You just jumped in as if we don't even have to say who's here. We're very excited.
It's a rookie mistake here.
It's a rookie mistake. You can tell it's a baby podcast. You're making mistakes.
She likes to point out.
I do.
All right.
I do.
Yes.
Welcome.
So, I'm Dr. Jessica Quimby. I'm an associate professor at The Ohio State University, and happy to be here to talk about kitty things.
So you're a veterinarian?
Yes, I'm a veterinarian.
And you have a PhD. What's your PhD in?
My PhD is in feline chronic kidney disease. I studied kidney disease in cats. And I'm a small animal internal medicine specialist. So in addition to being a veterinarian, I then went and did further study in order to learn more about diseases, honestly, for me, that apply to the geriatric cat.
Yeah, and old cat.
And we did an episode on that. So how many years did you study in total?
Yeah.
Ooh, that's a good question.
Mm-hmm.
So,
gotta add them up. Let's see.
Wow.
Did you have a bachelor degree before the DVM?
I did. So I did the undergraduate, and I was an undergraduate for 5 years.
Okay, so 5.
5 years, and then 4 years of
DVM.
vet school.
Mm-hmm. So 9.
Yep, and then 3 years of the internal medicine specialty, and additional 2 years
12.
of the PhD.
15.
Yes. So
15.
12 plus 2 is 14, but that's okay.
Okay, whatever.
So
okay.
14 to 15 years, that's a long time.
It is a long time.
So it just shows you that veterinarians often get as much training, sometimes more, than physicians.
And where in Ohio is the Ohio State University?
It is in Columbus, Ohio.
Oh.
Yep, somewhere in the middle of that
the beautiful Midwest.
green state.
Mm-hmm.
Yeah.
So there's a veterinary school with a veterinary hospital there.
Yes.
Right?
And we have quite a lot of veterinary schools all over the U.S. So this is one of
and a few in Canada.
This is probably one of the top 5 vet schools in the U.S., isn't it?
Yep, I think so. Yep, we're right up there.
So your ideal day would be dealing with older cats, right?
Yes, absolutely.
Yeah, and why?
Absolutely. Well, I mean, I'm just such a cat person, but the older cat is just, they really struggle with a number of diseases, and we really just want to identify when they're sick. That's an important point. How do we know the cat is sick? And then how do we identify what is wrong with them that's making them feel poorly? And so, unfortunately for kitties, they tend to collect diseases.
Don't they?
So
I say they go shopping.
They
if they're on sale.
Right.
Buy a couple.
I'm going to get 3 more.
Get a selection.
That's right.
Yes.
That's right.
Because it is common for us to see older cats that have more than one disease.
It is. And unfortunately for kitties as well, chronic kidney disease, which is what I've studied, is very, very common in the older cat. And the older your kitty is, probably the more likely they are to get chronic kidney disease.
Yeah, I think it's kind of hard to avoid, actually.
It is.
If you live long enough.
It is. I'm always surprised, actually, when we see the older kitty. We get all excited. Oh, his kidneys are doing really well. This kitty doesn't actually have chronic kidney disease.
And that's unusual.
It is.
Yeah. So that's one really common chronic problem. that, but the good news is it can be diagnosed and it can be managed, right?
Yep.
And so what are some of the challenges in managing these cats that get diagnosed with kidney disease?
So can I ask a question before we answer that?
Yeah.
So chronic kidney disease means that you cannot cure it. Is that correct?
So, I mean, that's a good, well, you could do a kidney transplant, but for most people, that's not really necessarily an option. And so we don't have a cure for chronic kidney disease. And really that term just means that there is something diseased with the kidney, but we have a huge spectrum of disease. So your kitty could have just a small amount of chronic kidney disease and they're really not noticing at this point in time, and it actually might be very subtle that that's what's happening with them. Or, unfortunately, they could be much later in the disease process. And they can have all sorts of complications of kidney disease, too, like high blood pressure or infections in the urine, electrolyte abnormalities, and most importantly, their appetite can be pretty poor.
So what would be the first things an owner might notice?
We often find that people will notice that they're you guys, we're having some.
I'm making Dr. Quimby laugh. I'm sorry.
Paying attention to what's going on.
I won't look at you.
Yeah. Paying attention to what's going on in the litter box is quite important, actually. So one of the things that we might notice is that they're urinating more, and that might mean that the litter box is wetter or the urine clumps are larger. And then along with that, they might be drinking more as well. But often it's very vague, like they're just losing weight. And of course, that can happen because of a number of diseases. So that's why we do need to do additional diagnostics when you see that your kitty is having one of those signs. We need to figure out what thing is happening associated with those clinical signs.
I wanted to explain that cats, just like humans, have 2 kidneys.
Yes.
And that it takes quite a lot of kidney to lose before any clinical signs start.
It does. And that's, I think, the thing that most people find a bit alarming is by the time we see clinical signs, usually we only have 25% of the kidney function left.
Amazing.
So kitties are actually really good at hiding their diseases. And they just pretend everything's fine, everything's good, and then
no
it's
problem.
not. Right. I'm good. All good here.
Yeah. I have a colleague who says a healthy cat sitting in the sun on the window ledge looks like a sick cat sitting in the sun on the window ledge.
It's true. I really struggle with that when I take pictures of my own kitties to use for lectures, and then I look at the picture and I go, that looks just like a sick cat. That was supposed to be a happy, healthy cat, but now I look at the picture, and so we don't know.
Yeah.
So
sometimes it's hard to tell.
If you don't recognize it, how can cat owners recognize this then?
So I think just knowing that there are those things to watch for, especially as your kitty gets older. Really paying attention to what goes on in the litter box. Are the stools normal? Are they too small and hard, or are they loose and they have diarrhea? Are the urine clumps changing in size? And very, very special attention to how much the cat is eating. And of course, you pet your cat all the time, so what's happening with their body condition? Are you noticing them lose weight, or maybe they're getting more bony as you're petting along their back? You can feel the spine a little bit. That's definitely an indication that it's time to check things out.
So it's about change.
It's about change. Any change from what you consider to be normal. Yeah.
And that's called muscle condition.
It's the muscle condition. Yep. So when you feel that they're a little bit more bony around the back, that's because they're losing muscle on either side of the spine. And so you can feel it in your own spine, right? You can feel that muscle on either side, and kitties have the same thing. And so when they start to lose that muscle mass, that's actually one of the first places we see it. That's most obvious.
Yeah, and cats have a high protein need, right, in their food, and that helps. One of the things that helps is maintain their muscle. So they tend to lose muscle easily, don't they when they're sick?
They do. Unfortunately for them, I mean, all of us would love to lose the fat.
And not the muscle.
And not the muscle, but kitties are in the unfortunate position that when they aren't eating correctly or something is going awry, they lose the muscle instead of the fat.
So it is possible for a cat still to have a lot of fat.
Yes.
Yeah.
So that little, jiggle
on the tummy.
That's right. The jiggle might still be there,
so
but they might have. It is deceptive.
But if you pat them along the spine and they feel bony, that's not normal.
Nope.
And there's a lot of reasons why you can lose muscle. Decreased activity, for instance, can cause muscle loss, and it's
But
of course nutrition.
It shouldn't cause that much muscle
No,
loss,
that's
though.
true. That's
so,
true.
Yeah,
and what would you then say to, because for owners it's difficult. They see the cat all day long.
Right.
It's difficult to assess if there is, for instance, weight loss or muscle loss. You were explaining that muscle loss you can feel on the back of the cat. Weight loss, how do you see that?
Well, honestly, many owners weigh their cats.
Yes, so that
regularly.
would be
I
an
would,
advice.
yes, absolutely. And that's an important thing to keep track of. And of course, even if you're not weighing your kitty in the home environment, this is one of the reasons why just regular checkups with your veterinarian can be helpful, because they haven't seen your kitty in a while, and they will maybe notice a change that has been so subtle it's not noticeable at home because you see your kitty all the time.
What's the best tip to weigh your cat?
Ooh, we like to tell people to get baby scales.
That's what I would say.
Yeah, baby scales can be really helpful. You can find them on Amazon or whatever, and that's something that, and especially if you know your kitty has a disease already, we often recommend weighing them regularly to make sure we're keeping up with the nutrients that we want.
It's a small investment, but it's really useful information.
Yes, and if you have multiple cats, then
then
can
it's
just
a good
weigh
investment.
everybody.
Yeah,
It
it's
goes
funny
pretty
that it's
far.
such a simple thing,
Yes.
but
It is.
unintended weight loss, even a little bit,
Can be a
how
big
much
deal.
how much weight loss, how little matters to a cat.
Gosh, kitties are small, and even for a cat, 5% weight loss or only 10% weight loss, this for a cat doesn't end up being very much. That's like a very small amount.
It's like ounces.
Ounces, really.
And this is probably also the reason why using a human weight scale is not the ideal thing to do.
Correct. So, some people think I'm going to take my kitty and I can step onto the scale and then try to weigh them and subtract, but it honestly would be better to get that smaller baby scale. You'll get a much more accurate weight.
And just to put it in context, like if your cat has lost, let's say, 10% of its body weight, that's like a 150-pound person losing 15 pounds. And then it sounds a little more serious, doesn't it?
Yes, and especially if you were trying to achieve that, you'd be real proud. Like
You'd
that'd be like
thrilled
right?
if you were trying to do that, right?
Most people struggle to lose 5 pounds, right?
Yep.
So then when you put that in
context.
in context,
And here's your little kitty losing,
Right.
10%.
Right.
It might
It's
be a
big
small
deal for
number,
them.
but it's a big deal.
So
It's a
is
big
it now
deal.
time to answer the question what anorexia is?
Yeah, we started with that. What? Oh, that's a good word. Let's break down that
Jessica.
word.
Yeah, so to me, anorexia means that they're not eating at all, but that's pretty serious. So I would think more about being very aware if your kitty's appetite has changed at all. Again, we said changes were important. So if your kitty becomes pickier or their eating habits change, they're not as interested in foods or they don't eat for as long. That's more subtle than that anorexia, and that can be important too. So I would want to know that that's going on even before we get to the point of total anorexia.
And there's also a word for that, a difficult word.
Yes, that's dysrexia.
Dysrexia.
So that root word, I don't know if it's Latin or Greek. Do you know? Like
I
rex,
don't.
the
Yeah.
R-E-X.
It's always Greek.
Is it
It's
always
always
Greek?
Greek.
Okay,
It's
the
always
answer's
Greek.
always Greek.
It's
Yeah,
always
we're
Greek.
probably wrong.
Yeah.
So we say hyporexia sometimes. So hypo means less.
Right.
Rexia is about eating, I guess. So
Yep.
smaller appetite.
Dysrexia would
Means
be it's
abnormal,
Different.
I guess.
It's
different.
Different.
Yes.
And then the rex for appetite.
Yeah.
And then anorexia, usually
Means
the AN
no.
means nothing.
Yeah.
Yeah. So no appetite.
And then they just
yeah.
put an O in for
Yeah. So you can say it.
anorexia.
Yeah.
It's not the right
Yeah.
thing.
doesn't have quite the flow,
No, it
right?
doesn't,
Yeah.
it doesn't. Okay, so I bet it is difficult for owners to see the change from when we talk about dysrexia, the change in appetite. So what are some tips that you can give them to recognize that the cat is eating less or changes their eating habit?
I mean, that's a great point because it really is important to pay pretty close attention to what your kitty is eating, right? So, I mean, when we have people come into the vet's office, we're asking how much of the food is your kitty eating, what kind of food, and those really specific questions. So not only would it be good to know those answers when you come into the veterinarian's office, but you should have a good idea for them at home so that you can notice those changes. And that way, for my kitties, they eat a certain specific amount of of food over the course of the day, and each one of them has their own allotment, and they eat in different areas of the home, and they eat with like the interactive cat feeders, but I have a very good idea of what everybody is eating and if they have met their caloric needs. So I'm monitoring that situation very, very closely, because that's key. The second I see somebody doing something different, I pay more attention to them.
But that's not how most people feed their cats.
No,
Probably
right?
Right,
yeah.
Yeah.
It in the bowl,
Most people
you?
just leave a bowl of food out.
Then you don't know.
And that's the problem.
Yeah.
Then you don't know.
Especially if you have more than one cat,
Then you
right?
don't
So
know.
then it's like the trough,
Yeah.
right? So who, then maybe, and then you have this kitty over here taking advantage and he's eating more, and this kitty over here is eating less, and then you don't have a really good idea of what's going on with
And it's pretty typical in
with the
households to
clouder.
have a really fat cat and
It is,
a couple of skinny
unfortunately.
ones,
So-
and so you know what's
Right.
happening there.
Right.
And we need to know for both of them, because
I
one
know.
needs to lose weight.
Right, and the other one needs to gain a bit. So
Yep.
so really having a good idea of monitoring what they're eating on a daily basis is really important to help recognize that change quicker.
And yeah, you'll figure it out quicker.
Yeah.
Yeah. I think people tend to notice quicker with the other companion animal species, which shall not be named, when they are not eating, because we feed them differently. Right?
Correct.
It's a little bit more interactive exercise.
So,
But
but
most of them, they scarf their
and
food.
they eat their food
They do.
quickly,
And
so
within
you
5
notice.
minutes. So if
Right.
that doesn't happen, you're like, something
so,
is wrong.
But I mean, all sorts of different feeding styles can be adapted, and we have these. It's really great now. We have all these interactive cat feeding devices, but that doesn't mean that you still can give a certain amount of food. So I use these interactive cat devices, but still this kitty gets this portion and this kitty gets this portion, and it takes them much longer, and they have fun doing it, and it's great. But then we still know you've eaten all your portion.
And you weigh the food before you give it, or you just
We
use
measure it. Yep. So we have a little measuring cup. We have piles of quarter cup measuring.
For measuring food.
So we're always picking them up at Goodwill. So like, we need another one. They're everywhere in the house. So for the majority of the time, I'm looking at how many calories each of my cats need, and most of them are getting about that amount of food twice a day.
Yeah.
But it's spread out as per their feeding preference.
And that kind of mimics a little bit how a cat would feed himself.
Yeah.
Right? Because if you have to fend for yourselves on the streets of San Francisco, where we are today, you're kind of foraging all day,
You are.
right? You're hunting
You are.
and you're eating a lot of little meals.
Yes.
You're not walking over to the buffet at the local restaurant. And
Yes.
eating
And
it all.
we very much use it for interactive things. So, I know how much in the day that I want them to eat, and then we might use part of that portion for treats, or part of that portion for a game, or hey, it's time for you to go upstairs now and do this, or can you guys go over there because I need to vacuum?
So it's very interactive.
It is
You
very
can do a
interactive.
lot with it.
Yes,
Oh, I like that.
So, and especially since we have different work schedules for the people in the house, and then someone can always we have a lot more interaction with the cats that way. It's more fun. They like it when we throw the kibbles. They go chase them.
They can chase a kibble.
Yes.
Yeah.
What if an owner is worried about eating habits of their cat? What should they do?
Well, obviously we need to get an idea of what they are currently eating, but I would really recommend that kitty be seen
By a veterinarian.
They need to be seen by a veterinarian, and that could be a subtle sign that there's something not right. And kitties, again, are very good at hiding when they're sick. They just kind of hang in there and they pretend, I'm just fine, everything's fine. And then,
And in reality, they're going to die on Tuesday, but they haven't told you. Yeah.
Right. So they're very good at that. And so if you notice any of those changes, then it's definitely time to be checked out by your veterinarian. So have them checked out.
Yeah. Cats are often kind of hard to figure out, but
They
that's
are.
our job, right?
They like to be. They're
mysterious.
Mysterious that
Yes.
way. So.
This is a great ending.
Wow.
Yes.
On the mystery of the cat.
The mystery of the cat.
Yes. I am
This is
cat.
wonderful.
Do not try to understand me.
I know. Didn't we say cats are aliens?
Cats. You've said cats are aliens. I like that they're mysterious.
That's right. Yeah. That's right.
Yeah.
Aliens are mysterious too.
I guess so. I think they're a little scary, personally.
Thank
Great
you so
chat.
much.
Yes,
That's
thank you
wonderful.
both.
Thank you.
Hopefully great
this is
advice.
It's very fun to
awesome.
be here and chat
Thank
about
you.
kitties. We love
Yay.
kitties.
Yeah. We really should bring coffee to this, shouldn't we?
I do have coffee.
Oh, yeah. You have coffee. I like that. He says, I have coffee.
Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat, Clinical Medicine and Management, and August, Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs, and you can follow her on social media with the handle @CatVetSusan. Dr. Yola Kerpenstein is a diplomate of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Yola works currently at Hill's Pet Nutrition. You can follow him on social media with the handle @GBETSX. The opinions of this podcast are those by Dr. Susan Little and Dr. Yola Kerpenstein. Veterinary medicine is a complex profession, and often there are multiple diagnostic and therapeutic options for different disease processes. If you're a pet owner with questions, please go to your local veterinarian.
Both Dr. Susan and I sincerely thank Jake Adams for composing and performing the music.